If you're watching this video, you're probably getting ready for Medicare's annual enrollment period, or maybe you're just planning ahead for 2026 and want to know what the best Medicare Advantage plans are going to look like. With so many changes coming to Medicare next year, it's really important to understand what's new, what's better, and what to watch out for. Medicare Advantage, also known as Medicare Part C, is one of the most popular ways to receive your Medicare benefits, and it keeps evolving every single year. In this video, we're going to break down what's changing in 2026, what new benefits are being added, how premiums and out-of-pocket costs are shifting, and which companies are leading the way with the best plans available. By the end, you'll have a clear picture of what to expect, how to compare your options, and how to choose the right Medicare Advantage plan for your needs in 2026. Let's start with the basics. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They combine your Part A, hospital coverage, Part B, medical coverage, and often Part D, prescription drug coverage, all into one plan. Many also include extra benefits like dental, vision, hearing, transportation, over-the-counter allowances, fitness memberships, and sometimes even meal delivery after hospital stays. These plans are becoming more and more comprehensive each year, which is why over half of all Medicare beneficiaries are now enrolled in Medicare Advantage instead of Original Medicare. Now, as we look toward 2026, there are several key updates that make this year especially important. One of the biggest changes is tied to the new Medicare drug pricing reforms that start rolling out in 2025. These reforms will continue to impact Medicare Advantage plans in 2026, especially those that include prescription drug coverage. For the first time, there will be a hard cap of $2,000 on out-of-pocket drug spending, and this is expected to make many Medicare Advantage prescription drug (MAPD) plans even more attractive. Insurers are already adjusting their plan designs to align with these lower medication costs, which means you might see new plan options with improved coverage for expensive brand-name drugs or chronic condition management. Another big trend we're seeing for 2026 is a continued push toward expanded supplemental benefits. In recent years, Medicare Advantage plans have started including more non-medical benefits that can help improve quality of life. Things like grocery allowances, utility bill assistance, home modifications for safety, and even companionship or caregiver support. In 2026, more carriers are expanding these benefits to reach seniors with different needs. For example, some plans are offering increased monthly grocery allowances that can be used at select stores, while others are enhancing fitness and wellness programs with more personalized services and digital health apps. Of course, one of the biggest questions every year is how premiums are changing. The good news is that, on average, Medicare Advantage premiums are expected to stay relatively stable for 2026. In some areas, we may even see a slight decrease in average monthly costs. According to early projections, the average premium for a Medicare Advantage plan may hover around $19 to $21 per month, similar to 2025 levels. Many plans will continue offering $0 premium options, though you'll still be responsible for your standard Part B premium, which is expected to increase to around $206.50 per month in 2026. But while premiums are holding steady, the cost sharing and out-of-pocket limits are changing slightly. The maximum out-of-pocket limit for in-network services in 2026 is expected to rise modestly, from around $8,850 to approximately $9,200. That means if you have a serious illness or need a lot of medical care, the most you'll pay out of pocket for covered services before your plan pays 100% is about $9,200. Some plans offer lower limits, so it's always smart to compare that number when reviewing your options. When it comes to choosing the best Medicare Advantage plan for 2026, it's not just about price, it's about value and coverage. Some of the top-rated carriers consistently offering strong plans include United Healthcare, Humana, Aetna, Blue Cross Blue Shield, and Kaiser Permanente. These companies continue to receive high CMS star ratings, often 4 stars or higher, which reflect quality of care, customer service, and member satisfaction. For example, United Healthcare remains one of the largest Medicare Advantage providers in the country and often includes extra wellness programs and gym memberships. Humana is known for its strong chronic condition management plans, particularly for heart disease and diabetes. Aetna continues to shine for its low-cost plans that include broad networks and additional wellness perks. Kaiser Permanente stands out for its coordinated care model and high satisfaction rates in states where it operates. But beyond brand names, the best plan for you depends on your location, your doctors, your prescriptions, and your health needs. A plan that's perfect for someone in Florida may not even be available in Texas. That's why it's so important to use the Medicare Plan Finder tool on Medicare.gov or to talk with a licensed Medicare specialist who can compare the plans in your zip code. In 2026, experts are predicting more local HMOs and PPOs entering the market, which means more competition and more choices for beneficiaries. Prescription drug coverage will also play a huge role in plan selection this year. Because of the new $2,000 out-of-pocket drug cap, plans are restructuring their formularies to give better access to high-cost medications. Many plans are adding extra savings on insulin and vaccines, both of which are now capped or covered at no cost. If you take brand-name medications, 2026 could be a great year to review your options because the Inflation Reduction Act's continued implementation will likely make some medications significantly cheaper under certain Medicare Advantage drug plans. Now, let's talk about something that doesn't get discussed enough: provider networks. One of the biggest differences between original Medicare and Medicare Advantage is that Advantage plans require you to use doctors and hospitals that are part of the plan's network. In 2026, we're expecting to see an expansion of PPO options, which allow you to see out-of-network providers at a higher cost. This flexibility can be really valuable for people who travel or live in multiple states part of the year. Meanwhile, HMO plans, which require you to stay within the network for most services, are still the most common type and usually have the lowest premiums. Another thing that's expected to continue growing in 2026 is telehealth coverage. Since the pandemic, Medicare Advantage plans have been leaders in offering telemedicine services, allowing members to see doctors, therapists, or specialists from home. In 2026, nearly all plans are expected to maintain strong telehealth benefits, and many will expand into virtual physical therapy, mental health counseling, and chronic care check-ins. This makes care more accessible, especially for those with mobility challenges or people living in rural areas. Let's also take a moment to talk about dental, vision, and hearing benefits. These are some of the most attractive parts of Medicare Advantage plans because original Medicare doesn't cover these services. In 2026, we'll continue to see plans offering enhanced dental benefits, sometimes up to $2,000 or even $3,000 per year in dental coverage. Vision benefits will continue to include free annual eye exams and allowances for glasses or contact lenses, while hearing benefits often include free exams and discounted hearing aids. If these are important to you, look closely at each plan's limits and provider networks, since not all dental or hearing services are covered equally across insurers. Something else that's new and exciting for 2026 is the continued focus on preventive care and wellness programs. Many plans are investing heavily in programs that help keep members healthy and out of the hospital. These include annual wellness visits, free fitness memberships like Silver Sneakers or Renew Active, smoking cessation programs, weight management tools, and even grocery delivery for those recovering from hospital stays. Plans are recognizing that helping members stay healthy saves money in the long run and improves overall satisfaction. We also can't ignore how Medicare Advantage plans are handling chronic care management in 2026. For people living with long-term conditions like diabetes, COPD, heart disease, or arthritis, some plans now offer specialized care coordination teams. These teams help manage prescriptions, schedule appointments, monitor health data, and provide ongoing support. Some even offer devices like glucose monitors or blood pressure cuffs at no additional cost. This level of personalized care is becoming a major factor in choosing a plan, especially for older adults managing multiple conditions. Now, while all these benefits sound great, it's important to remember that Medicare Advantage isn't perfect for everyone. Some people may prefer the flexibility of original Medicare with a Medigap policy that allows them to see any doctor nationwide. But for those looking for all-in-one convenience, lower premiums, and extra perks, Medicare Advantage can be a smart choice, especially with the expanded benefits we're seeing in 2026. When you're comparing plans, remember to review 5 key factors: monthly premium, out-of-pocket maximum, drug coverage, network size, and extra benefits. Write these down and compare them side by side for the plans available in your area. Also, check the CMS star rating. Anything 4 stars or higher is a sign of good performance and member satisfaction. If you find a plan that seems perfect but your doctor isn't in the network, it's worth calling your doctor's office directly. Sometimes providers are added late or plan networks change right before open enrollment begins. You can also check to see if the plan offers an out-of-network option, especially with PPO plans. Another piece of advice: don't just look at the plan you have now and assume it will be the same next year. Every fall, Medicare Advantage plans release their annual Notice of Change, which lists updates to premiums, copays, deductibles, and benefits. Review that carefully before you decide to stay where you are or switch. A plan that was the best fit for you in 2025 might not be the best in 2026.